You're listening to the Movement is Medicine show, podcast hosted by Head to Toe Spine and Sports Therapy, a modern chiropractic and manual therapy practice in Edmonds, Washington. Now, let's get into the show. Welcome, gentlemen. How's it going today?
Good.
All right.
What's up,
Barry?
Barry?
Bruce,
Morning.
Lee, Tim.
Yeah.
A full house here in our studio in clinic.
In clinic, yeah.
And today we're talking about something that is near and dear to our hearts as a chiropractic and manual therapy practice, and that is, what is an adjustment? What is a chiropractic adjustment? Because I feel like there's a lot of confusion around this, and there's a lot of different patient experience with adjustments in other practices, and a lot of different styles of chiropractic adjustments, and I think it can lead to some confusion.
Yeah, I think what you just touched on there is a big part of it is the different styles of chiropractic, because there are so many different techniques within chiropractic that you can use to deliver an adjustment. And I think that's where some of the confusion can arise from sometimes, is because like different practitioners will use different techniques, and sometimes like you get used to a certain technique and then you have another one done and you're just like, well, was that really like a chiropractic adjustment? Did that really? And it's like, yeah, like there's various different techniques that can accomplish the same goal when you're talking about the adjustment. So
yeah, there's a whole different spectrum. You could use different tools. You can use your hands. You can use different forces. Realistically, what you want to have is an adjustment that's tailored to you personally, something that's going to agree with your body personally, not necessarily the same thing that your friend's getting or your family member's getting.
Yeah. I think that's a unique feature of the office, too, is that we offer a variety of procedures. And just like you said, we try to gear it to the patient's care. What has really been successful for you in the past, but also on the other end, we practice some new technology, some new procedures. We've integrated things in a way that could be even more effective for the patient. So we do value your input and what happened in the past, but there's new things for the future.
Yeah, it's interesting because I do think so much of, if patients come in and they're thinking, okay, I'm going to see a chiropractor. That means I'm going to get my back cracked because a chiropractor cracks back or they crack necks. I do think that there is a simplification like, well, how is this even chiropractic if I'm not getting my back cracked? Because you're absolutely right, Bruce. I think, we have kind of new technology, new techniques, new procedures. Science is evolving. Chiropractic as a medical field of study is evolving. All of those things have changed. And yet, if you're a person who has gotten chiropractic done, say, in the last 10 or 15 years or 20 years, and that was your first experience, there was the whole kind of, the cracking methodology of either twisting forceful spinal compressions or whatever. That was your experience.
yeah, no, absolutely. And I feel like you just said, things have changed a little bit. There's a lot of research coming out nowadays that shows that different techniques are just as effective. And just what you touched on before, I think it's really got to be tailored to what the specific needs of the patient are. Whether or not they're going to benefit from a manual type adjustment where you might get some of the pops and everything like that. And we'll get into what that actually means a little bit after this, or they might benefit more from a low force adjustment. And it really is taking a look at your patient, what they have going on, the symptoms, the signs and symptoms, and really making an educated decision on what's going to be best for them at that time.
If someone were to say, well, if I don't get an adjustment, is this chiropractic? How would you explain kind of what the chiropractic framework is?
Well, the first thing you want to definitely sort out is whether or not the patient can accept the adjustment. Oftentimes when we get people in the office, especially when they're acute, they can't actually handle a high velocity adjustment. We want to work them up to that because ultimately that's going to prepare them to do high velocity activities. But most people don't actually need that initially, and I'd say it's probably detrimental for some people if you give them a forceful adjustment too soon. So we like to really work people up here. We make sure that somebody's like we said, we can use some tools. We can use an activator, which is essentially like a little hand piston that you put right on the vertebra, and you can click it a couple times, and it'll nudge that vertebra forward a little bit, or depending on which direction you want it to head into. So with that, I think it really comes down to making sure that the person is ready for the adjustment rather than just jumping right into it and giving everybody the same thing.
Yeah, and Dr. Lee, like he says, it doesn't always require a lot of force, okay? You can make some changes with a very gentle, specific mild input. Because I guess we have to do is let's look at what we're trying to accomplish, right? We're trying to accomplish a change in the overall alignment, the change in the posture, the change in how the body operates within gravity, in that central line of gravity. Those are some of our goals. Also, the adjustment makes a profound change on the nervous system, which is the computer for the human body. So that's what we're after. So we're not after to hear a nice big pop, which is associated with some of the original forms of chiropractic technique. But we're after those points that I just listed. So when you come in, and especially if you're in severe acute pain, we could get those changes in gravity, changes in the alignment in gravity, changes in posture without the pop. So,
right.
Yeah.
And just kind of going off what Bruce said, like the nervous system being the computer for your whole system, the body being the vehicle. Essentially, what we're doing with the adjustment is we're reintroducing motion that has been lost. So we're bringing say a vertebra isn't rotating properly to the right, so you're not able to twist to your right all the way. Whether there's pain or there's just a lack of motion, that's an issue. We should have that capacity to move. So we're restoring that right rotation when we do the adjustment. And then oftentimes in our office, we're going to add exercises and more rehab techniques just to reinforce that motion itself. So essentially, we're getting rid of the blockage, and then in our office doing exercises, we're reinforcing that motion so that it will hold a little bit more effectively.
Yeah, and I think that that blockage thing and kind of like that restricted motion thing is an important thing to realize too, because a lot of people, they'll come in also, and I'm sure we've all had patients like this where they'll talk about well, I can pop my own back or pop my own neck and stuff like that. And it's well, that's great and all, but you got to realize that when you're doing that, you're usually only mobilizing segments that are already mobile. Those are the only ones that are actually going to do that when you're popping your own back. You're going to hear those pops on the segments that are mobile. The segments that need the influence to kind of recorrect that posture and recorrect that center line of gravity, like Bruce was talking about, those are the ones that are not actually being influenced or being moved when you're doing that to yourself. So as much as people say that, I can pop my back or pop my neck, you're only mobilizing what's already mobile. You're not actually getting the influence on the joint that you need to restore proper function.
Hey, here's another point too. The nervous system, the brain, the entire nervous system is made mainly what you call sensory. Input, hot, cold, motion, how fast you're going. Actually, the majority of the nervous system is that. And so what we want to also influence is that input back into the brain, into the nervous system. And that helps to shift all the other factors, how your muscle contracts, how things shift in alignment. So we're interested in your nervous system. Mm-hmm. That's what we're really working on.
I think that's a big key right there, because that's a big distinction is we're not chiropractors. A lot of people think, we're just doctors of the spine. And that's not really a great way of thinking of it. We're doctors of the nervous system. That is a much more accurate way of describing that, because it's not only just the joints or your spine that we're affecting, it's the nervous system as a whole, muscle function as a result of that, and various other things as a result of that. So it's really taking a look at the body as a whole and the nervous system as a whole and how we can influence that through adjustments and through other modalities that we use here.
We were talking with Dr. Armstrong before we started today. And the real important point she brought up is we were talking about how people get adapted to a bad situation. They're in a skiing accident and really bummed up pretty bad and a lot of pain, and they're hobbling around for 3 weeks. And then they say, "Oh, the pain went away. I'm okay." And then after a couple months, your friends ask, "Well, why is he always limping, or why does he move funny like that?" Well, your body really adapts to compensates for the injury you sustained, and that's part of our procedure. We're looking for that. We want to get rid of that compensation. We want to get rid of that body adaptation to that bad problem, and that's why sometimes it takes a little time, but it just goes to show you how injuries, even years ago, can set itself up to be a problem today.
Yeah.
So pain went away, but the problem is actually still there.
Because of the compensation and because the body's this incredible thing that wants to find a way for you to continue to function and continue to do stuff, even when the kind of proper movement pattern isn't possible, it shifts.
Yeah.
So then when the movement pattern becomes possible again, when it's not a physically limited thing through inflammation or injury or whatever, the body doesn't just naturally go back to that movement pattern.
Right.
No.
Without help.
And that's the most incredible thing about the human body is its ability to adapt to any stress. And whether or not that adaptation is beneficial for the body, it's going to adapt so that it can do the function. So over time, obviously, when you have a bad compensation, you're going to have different types of pains showing up. And oftentimes what we have to do is unravel those new pains, and then the old pain will show right back up. So a lot of people think that the pain just went away all of a sudden. It doesn't do that. It oftentimes comes back, and it'll scream when it comes back.
Or it might show up in a different place in the body, right? To your point, like in there, it will start screaming and will seem to be completely unrelated maybe to that earlier injury or that other point of origin because of the compensation patterns that have now transferred the dysfunction to another part of the body.
Yeah. And I feel like that's something that we do really well here is like finding out like what those compensation patterns are and really not just treating like the symptoms, like not just treating what they have going on, like what they're like presenting with, but really trying to unravel that back, like Lee said, and really trying to dive into like, okay, why did this happen in the first place? How can we prevent this from happening again?
I'd say 90% of the time, the problem is not where the pain is. Okay, you can have problems with that shoulder. You could have a mild little tear in the rotator cuff, but the problem is usually not there. Like we were saying, the compensations, the patterns produced too much stress in that shoulder and wound up with some abnormal movement in the shoulder and with a little tear there. But the problem is usually not where the pain is.
The origin, the root cause.
Yeah.
So that is why in some cases, I think the adjustment, like a manual adjustment here, isn't necessarily the first thing that we would do, or even do at all, depending on the situation that a patient is in and what's presenting, and that detective work that's essentially happening to uncover what's the root, what's really going on here. And how do we also get somebody out of the immediate pain of the situation, reduce the inflammation, bring back some mobility and some stability, and get them into a spot where they're better off. An adjustment may or may not be the thing at that point to do that.
Absolutely. Yeah, absolutely.
And I think, Lee, you brought up a good point earlier, too, with the whole adjustment thing. And you're talking about the gun. And, Bruce, you were talking about levels of force on adjustment. And it's interesting because I think all of us have had that experience. I know the first time I went to see a chiropractor, it was a mix. It was not here, guys. It wasn't here. This was like years ago, back in Western New York. And it was a mixed experience. But there was an element, and what was mixed about it was that he tried to sell me into like a $10,000 package of like coming to see him for like 15, the blah, 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 the old school style. But what was amazing was the relief that I experienced. And it almost seemed magical because he had me lay on a bed, put a warm weighted blanket, did some just light adjustments to my hips, and I walked out of there feeling so much better. And what blew me away was this like almost magical experience of like, what did he even do? And then I walked out and I felt so much better. Now, everyone's had that experience who's had some, in my mind, some good experiences where you're like, wow, I didn't even realize you did something there, and now I feel so much better. I had this experience, Bruce, when we worked together, but then I also had the experience where I knew exactly what you were doing because you're doing some fascial work in like the psoas area here, and I was feeling that. That one you could tell something was happening. But it was that experience of like a small adjustment, very light force, but produced a pretty big output.
Yeah.
And that's something that if you don't understand the science behind it, and you don't understand the language of the nervous system, you don't really get what's going on there. Mm-hmm. And that's where I think sometimes it seems like, well, can a light force or light touch even produce a result? I mean, doesn't it have to be forceful because I'm feeling such an intense feeling? So don't I need an intense treatment protocol?
No, and not necessarily. And like we said before, that completely depends on the patient. And I think that, even for us in this office, I would say probably myself, probably more so than a lot of the other docs here, I do use more manual, like what you would consider like a manual adjustment. But even when I do that, like you said before, it's a very light force. And that's the important part about it, right? It's like you don't need high force, even with a manual adjustment, to make an influence, to make a change on the spine, on the joint, whatever you're trying to influence at that time. It doesn't need to be a high force thing. And then, like we talked about before, it can be other treatment styles for adjustments that we can use also. But like you said, with chiropractic, you do hear a lot of stories like that, right? Where it's just kind of like that magical experience. I mean, there's a lot of really cool stories about chiropractic care and like what it can do for people. And I think what that comes down to is what we touched on before, is how much we are influencing the nervous system when we work the way that we do. Like, it's like if we have like nerves that are just not quite functioning the way that they should, or like areas of the body that just are not feeling right, really that comes down to a nervous system type issue. And like through adjustments, through other modalities that we use here, like that's where that magic happens. Like that's why we get those responses from patients that they're not really experiencing somewhere else.
Yeah, and ultimately,
and it's like we're looking again at two components, right? We're looking at a physical component. You remember I think it's called the Tacoma Narrows Bridge. Back in the 60s or 70s, the wind was blowing, right? And the wind hit just the right frequency to cause the bridge to collapse. You've seen opera singers sing and be able to crack a glass, right? It's using the proper frequency on that physical structure. Everything, I don't care what it is, hit it with the right frequency and it will crack, all right? So the same thing here with the human body. We're making an input, and fortunately it affects the nervous system, and it affects that physical structure we call the spine. So it moves, it changes, it shifts. And that's really what we're after, so that the computer shifts.
Mm-hmm.
Yeah, and sometimes like math equations can multiply. You need a small stimulus to multiply something into a large stimulus. Like it doesn't take much oftentimes. Like, and a real specific story I give you is like I had a rugby player that had if you've ever seen a rugby game, you know that there's a scrum when 8 people just crash into each other and they're trying to overpower the other 8. So there's a lot of force involved, like thousands of pounds of pressure in 20 seconds that they end up standing up and running away and not passing out, which is impressive in and of itself. But those guys, they would react extremely well to a very non-force style adjustment when they're laying on their stomach and you literally just press a spot in the back of their neck and all of a sudden everything's gone. Like their headache's gone, their trap tension's gone, everything that they thought was an issue before had released, and it's such a complete opposite of the stress that they're used to that their body reacted so quickly to it because it was just completely different than what their normal stimulus is. And I think that most people react like that. When you find the right thing that they need, oftentimes the correct outcome will present itself.
Small hinges swing big doors.
Exactly.
Well, guys, this has been really helpful because I think that for many people, this is an area where they're just not 100% clear. And bottom line is, if I were to kind of summarize what we talked about today, our end goal is to produce a change in that nervous system and in that structure that is positive and beneficial. Adjustments play a role in that, and there's a variety of adjustments that can come into play. Sometimes they're a little bit more intense. Sometimes they're much, much lighter and precise. But that is one technique in an arsenal of tools that we're really using to affect large and significant and lasting changes, which is why we just don't only do adjustments. And it's also why we do adjustments. Mm-hmm. They have a proper place in our treatment protocol and our methodology to produce the outcome that we want for our patients, which is to get them feeling great again.
Yeah, absolutely. We're just trying to improve their function, get them feeling great again, really dive into why they're having pain in the first place. And we here at Head to Toe, we really do have a great team of people that we can talk a lot about what's going on with our patients, really bounce ideas off each other. And we all do a great job, like I said before, really getting down to the reason why they're having pain and really eliciting like a long-lasting change that, like, you know, the pain's not going to come back again, which is a huge thing for a lot of people. And yeah.
And if you're coming in as a patient and you want an adjustment or you're expecting an adjustment, you should say something.
Yeah, Barry, talk to us. We're here to be of service to the patient, right? And your input is extremely valuable to us. Mm-hmm. So we really appreciate that and communicate.
Totally. And it could be a simple question of, are we going to do an adjustment today? Or I'm feeling like an adjustment might help. What do you think? And that then opens the door for the doctor team to provide insight and to say, maybe it is and maybe it isn't. And if it's not, here's why. And if it is, sure, well, let's put it in the mix.
And a huge part of chiropractic, too, is patient education. That's a huge part of what we do here, not only just treating the patient, but educating them on what we're doing and how it's going to affect them. And coming down to adjustment, that's like one of the most important things, no matter what form of adjustment you're doing, because, yes, some people might be expecting one thing, but as long as you talk to the patient, educate them on what you're doing and like how it's going to help them and like what the reason why you're doing it, then that's what you need to do, I guess, like just to put it very simply, like, and the patients really appreciate that. And then they understand why we're doing what we're doing and why they're receiving the care that they're receiving.
And I witnessed that firsthand. I don't know if you guys know, but I brought my daughter in. She's 12. She's been experiencing some upper back, neck pain. And Tim did an incredible job with her. It was so fun. I just was like a silent observer, like watching, dad watching. And it was so cool, man, because he was it was explaining exactly what was going on, took her through, did some releases, did some movement patterning, see what was going on, and then checked in with her to see if she wanted to do a light adjustment, and she really did want to do an adjustment. I think she'd been watching some YouTube videos. I think she was like super pumped for the adjustment.
Yeah,
and he did some back adjustment and did some stuff to her neck, and it made such a huge difference to her. It was incredible, and she absolutely loved it. And you were so gentle with her.
Yeah, and that's the thing is like, and that's a good example too. Is like even like somebody who's like 12 years old. It doesn't matter the age or anything like that. Like, and like I've said before,
just a little baby.
Yeah, right. I mean, like even with the manual adjustments, as long as you like know the correct technique to use and you're using light force, which is the way it should always be, then you can have really great effects no matter what. And I mean, but like we said before, like no matter what the patient needs, it's our job to be educated to decide what's going to be best for them at that point in time and what they're going to respond to best and what's going to have the best outcomes.
Yeah, I mean, and we do adjust babies in here. Babies, young children, pregnant women. It really doesn't matter where you are or where you're at. If you're in pain, it could probably help you get out of it.
Yeah.
And I mean, every time I see my niece who's out of state, I'd give her an adjustment, and that's honestly what my brother and sister are looking for every time.
Yeah.
So.
They're like, sweet, Lee's coming.
Yeah.
Gonna get my adjustments.
It's really cool. It's the same thing like my nephew, and then since he was like, a couple months old, now he's like 20 months old or something like that. Like, yeah, every time I see him, I like, and they love that. Just do like little adjustments on him. And it's really a great thing. I mean, even for any age. And I think that's something for people to realize is that like, it like chiropractic isn't just for like one demographic. It's not just for one person. It's really for everybody because we can really tailor it to exactly what that person needs. So,
well, there you have it. Whether you're young, middle-aged, old, a strapping young youth, come on in if you're feeling that pain or pressure. We have the techniques to set you right, including a variety of adjustments done expertly and professionally. Thanks, guys. This was super insightful. Until the next time, catch you later.
All right.
Thank you.